Hi, my name is Bryson. I'll be your student physical therapist today. Before we begin, could I have you please just confirm your name and date of birth for me, please?
Yeah, Risa Garcia, April 2nd, 1990.
Got you. Thank you so much. Well, Risa, I see you're coming in here because of headache pain. Could you kind of tell me like when did that start and how you think it started? Maybe?
I don't remember how it started, but I've been having this pain for about like half a year already.
Okay.
Yeah. Half a year, yeah.
Okay, sweet. And have you seen anybody for this?
No, I just did acupuncture.
Acupuncture, no PT in the past?
No.
How did acupuncture work out for you?
It didn't work. I felt like a waste of money.
Didn't work? Okay.
Yeah.
Gotcha. And what do you say like makes it worse? Any specific actions like overhead actions like looking up, looking down?
Looking forward, I noticed that my work, I'm a dentist.
Oh, okay.
I do a lot of like leaning forward positions.
That makes sense.
I know I should have better posture. They tell us in dental school, but you know sometimes you forget.
Yeah,
and then I noticed that by the end of the day, my headache gets worse.
Okay. Anything to make it better? Do you do anything?
I just lay down.
You lay down?
I just lay down, yeah.
Okay.
Just rest.
And how would you kind of describe like your headaches, like the type of pain? Is it kind of like sharp, like throbbing, or is it like dull and achy?
Dull, aching.
Dull.
Oh, back on the thing. I can't believe I forgot it. I do not only rest, but also I take medications.
Oh, okay.
Like just like Zyrtec and Toradol.
Toradol?
Yeah.
Oh, yeah. Okay,
Yeah.
sure.
So that and rest.
Got you.
My bad, I forgot.
No, it's okay. And where would you kind of describe like where the pain is?
Mostly right here, on the side of my head.
On the side, on the right side of your head?
Yeah.
Do you feel any pain like in your neck area?
Just mostly like it's stiff.
Just stiff?
Yeah, right here. Yeah.
Got it. And do you notice any like thing going down into your arm, any pain going down?
No, I
Nothing?
don't.
Just
Yeah.
stays in your neck
Yeah.
area and on the side of your head? Got it. And what time of day would you say is worse? Like when you first wake up or after a long day?
End of the day, after work.
Right.
Yeah.
Gotcha. Have you done any x-rays or gotten any MRIs on his neck before?
Literally got an X-ray.
X-ray?
Yeah.
Did they tell you anything about that or?
There's no fractures or anything.
No fractures?
No other stuff seen.
Okay, got it. Any like previous medical history with this neck or any previous medical history I should know about in general?
No. I mean, I fractured my arm like 6 years ago. It's not causing any problems.
Doesn't affect your daily life at all?
No.
No?
I mean, I just gave birth to a kid.
Oh, wow, congratulations.
Yeah.
Yeah, sweet. And you said you're a dentist. What kind of duties does that have you like physically be doing?
It depends on the patient. Usually I have to sit down, look over teeth. I check teeth. If I have to do some procedures, like taking in wisdom teeth, all that kind of stuff. It's what she's looking over.
Do you spend a lot of time at a computer too at all, or mainly just working on patients?
Depends. I got a lot of notes to do.
Okay.
Yeah.
Okay. Alright, then. That all makes sense. And I'm just gonna ask you a couple questions that I have to ask everybody, just to make sure nothing serious is going on here. So, have you had any recent unexplained weight loss?
Nope.
Any unexplained?
I mean, besides birth, giving birth.
Right. Unexplained fever or recent traumas?
Giving birth.
Okay, that makes sense. Any symptoms that felt very unusual or like any headache that you've had before? Unlike it. Alright. And you said no numbness or tingling.
No.
Tingling, correct?
No.
That makes sense. Alright, sweet. Alright. Well, that wraps up our first part of this. Next, we're gonna go look at some things in your neck, like your neck mobility, kind of its range of motion. I'm gonna be touching around in your neck area, if that's okay.
Okay.
Alright, Risa, I'm gonna have you sit on this table for me if you would, please.
Okay.
And now I'm gonna be observing kind of how your neck moves and what kind of brings upon the pain.
Okay.
So I just want you to copy me, alright?
Yeah.
So first, look forward down, straight down as far as you can. And I'm just gonna be applying a little pressure. And let me know if there's any pain, okay?
Okay.
Anything like that? And feel right about there. And now what I want you to do is kind of push into my hand right here. Perfect. Relax. Perfect. And this time, we're going to go the opposite direction. Straight up as far as you can. we're just gonna bend our ear to our shoulder. Any pain with that?
No.
No, I'm just gonna be applying a little pressure. Okay, right down there. And then this time I want you to press into this arm. Perfect, very strong there. And then we're gonna go to the opposite side. Let me know if there's anything.
Right there.
A little bit of pain?
Yeah.
I'm just gonna be applying a little pressure, let me know when to stop.
That's good there.
Right there, okay. And then this time, press into my hand, same thing. Pain, oh, there you go.
Yeah.
A little bit painful, okay.
Felt a little bit weak from the pain.
Yeah, sure. And then this one, we're gonna be now trying to look towards our shoulder as far as we can. Perfect, and just gonna go a little bit more, right about there. And now I just want you to press into this arm. Perfect, and now we're gonna go the other way. Any pain with that side?
Right about there.
I'm just gonna add a little bit.
That's good right there.
Okay, and also push into my hand. Up. Got it. Painful. Alright. Well, everything looks, nothing is very concerning. Everything looks pretty okay. Just a little bit of pain on that right side. Gotcha. Alright, so next, I just kind of want to observe how you would be at work. So pretend say there's a patient on this table. How would you kind of be, what's your kind of posture looking like there?
This.
Like that?
Yeah.
Gotcha. Okay. So kind of like bent over a little bit, right?
On this side.
Oh, okay. Got it. Alright. Okay, next, I'm sorry, I'm gonna have you take a seat back up here.
Okay.
Now we're gonna be kind of measuring how far your neck's moving. So, first we'll be doing flexion. So, looking how far down you can go. So, look straight down. Perfect. Now I'm just gonna be pressing down a little bit. Perfect. Now I'm gonna have you come back up. And then now we're gonna go the opposite way and look straight up to the ceiling. Like that. And then now we're gonna be doing, come around to the back here. Feel that right here. And what I want you to do is put your left ear to your left shoulder as far as you can for me, please. Right there. Perfect. And then we're going to be going the opposite way. A little bit of pain.
Right there.
Okay. Press a little bit more.
Right there.
Gotcha. Okay. And then now we're gonna be rotating our head. Give me 1 second. Perfect. So whenever you're ready, rotate to the left. Perfect. Let me do a little bit more. That normal. And we're gonna be going to the right side now, as far as you can without pain.
Like right there.
Pain's there. Gotcha.
Yeah.
Now I'm gonna be applying a little bit more.
Right there.
Right there.
Yeah.
Right. Okay. Yeah. We're seeing this about the same stuff. A little bit of restriction on this right side, but that's totally normal because of your pain.
Mm-hmm.
So next, I'm gonna have you laying your back for me, please.
You want my shoes off?
Oh yes, please if you can. Okay, for this, it's kind of gonna be an endurance test, kind of testing out the strength and endurance of your muscles that help you tuck your chin.
Okay.
So first, I kind of want you to make like a double chin if you could, and then lift off the table, and we're just gonna hold this, okay? Until you can't, right? Painful? Okay,
Yeah,
that's
perfect.
perfectly fine. You did a good job. Thank you. No problem with that. And then next, I'm gonna bring your head up. Alright.
Just take off the glasses.
Oh yeah. Actually, I'm gonna raise this table up a little bit.
Okay.
What'd you have for lunch?
That's some Bob's.
Oh, nice.
Yeah.
Sweet. Alright, so I'm gonna have you just, I'm gonna do this, relax for me. And then I'm gonna be rotating your head. Let me know if there's anything. Pretty good to the left side. And then now we're gonna go to this.
Oh, right there.
Right there,
Wow,
pain.
it's crazy. It's my headaches come by.
Okay. We'll stop that. Great. Thank you so much.
You're welcome.
Alright. Okay, and then next, I'm gonna have you flip onto your stomach for me, please.
Okay. Just take a deep breath.
And
Do you
then
have a towel?
what was that?
Do you have a towel?
Oh yeah, of course. Of course. And let me remove this because you're not your way. There you go. Let's get your glasses for me. I'll just put them on this table for you, okay? Okay. So I'm gonna be pressing down on different parts of your spine, and I just want you to let me know if it kind of recreates any of your headache pain or any pain at all.
Okay. Oh yeah, wow.
Pain right there.
That's weird. It doesn't try my head.
I'm gonna move down a little bit. Tell me if it's
Kinda. Yeah. No.
nothing.
No.
Nothing. Nothing. What about here? Nothing. We just gotta check all this. Nothing. Nothing. Okay. Just not.
No.
Okay. So it looks like there are recreations up here. So what I'm gonna do, I'm gonna be kind of pressing down on your upper cervical spine right here, in hopes that it'll kind of relieve your symptoms. But let me know if it's too painful, and then we'll just stop it. Okay.
Okay.
Just. That feel okay?
That's fine.
We can continue more of those later. But did I change your pain at all?
Kinda, yeah.
A little bit?
Yeah.
Okay, perfect. Yeah, we'll definitely do more of those later. I'm gonna have you come sit it back up. We're just gonna run one more test so I can move you out one more time.
Okay.
I'll have you sit at the edge of the stairs. Alright, so for this test, I'm gonna have you actually watch me. So first, we're gonna go back as far as we can. Wait, don't do it yet, just watch. And then we're gonna have you point your ear to your left. We'll go to the left side first, and then you're gonna rotate as much as you can. And then I'm gonna be applying a little bit of pressure, and you let me know if you feel anything with that.
Okay.
We're gonna go to the left side first. So first, look up to the sky, and then bend your ear to your left shoulder, and then rotate left as far as you can. Perfect. And I'm gonna apply a little pressure. Let me know if there's anything. Nothing? Okay. Next, we're gonna go same exact thing to the right side. So first, look up to the sky, ear to shoulder, ear to shoulder first, and then rotate.
It's a little hard there.
anything going into your arm at all?
No.
Just a little achy in the neck.
Yeah.
Gotcha. Alright. Well, that's all the tests that we're gonna be doing today. I'm gonna have you move back to the chair so we can talk about our plan of care for you.
Okay.
Sound good?
Yep.
Alrighty, so Risa, based on all the tests I did, it seems like your headaches are coming from problems within your neck.
Oh, really?
Yeah. So when you're at work, you're in that prolonged position of kind of like being hovering over a patient,
Mhm.
and being in that like all day puts a lot of strain on the structures in your neck.
Okay.
And also a lot of strain on the muscles in your neck.
Mm-hmm.
And these muscles and structures kind of help keep like they're what stabilize your head and what keep your head in place. And when you put so much strain on it, everything kind of stiffens up.
Mm-hmm.
The muscles they don't have infinite endurance, so they get tired, they get tight. Everything starts tightening up and stiffens up,
Mm-hmm.
and that's why it's referring pain to your headaches.
Mm-hmm.
So this is not serious at all. This is actually a very common type of injury that's very treatable with physical therapy. So what we're gonna be doing, we're gonna kind of work on the mobility in your neck, get it loosened up again through mobilizations and through things like fixing your posture. We'll also be working on strengthening your muscles that help stabilize your spine, so the muscles here and in the back of your neck.
Mm-hmm.
And yeah, like I said, I can also work on stiffening up with my own mobilizations. So today we're just gonna be doing exactly that, working on some mobilizations. I'll teach you some exercises to help strengthen those neck muscles, and yeah, we'll go from there. Does everything sound good to you?
That sounds good.
All right, thank you so much.